I'm Dr. Peter W. Carter. I'm a medical oncologist and hematologist with the Family Cancer Center, and the main practice I have is here at Baptist Memphis, and then I have a satellite clinic in Dyersburg. Well, so heart health, you have to look at it in terms of the type of heart problem you have. If it's a problem and you had a previous heart attack, and you have some problems with heart failure or potential heart failure, you have to be really careful about certain chemotherapy medicines that we're going to avoid. We don't want to give something that will make your heart problems worse, and that has happened. So it's important to know ahead of time if you have heart problems, especially heart muscle disease, where you've had a previous heart attack or heart failure. It's very important for us to know that ahead of time before we start the treatment. And then in terms of overall heart problems, it's real important to continue all the medicines, whether it's for blood pressure, to protect the heart, treatment to protect the heart, or medicines to prevent clotting or blockages in the heart, and cholesterol medicines. Anything recommended and being done by the cardiologist, it's real important to maintain that medication, because you don't want to get over the cancer and then end up with some worse heart disease. And it's also important to continue follow up with a cardiologist during the months of the treatment, because there might be other concerns and issues that could arise during the treatment of the cancer, where the heart, say a heart rhythm problem that goes off balance, and then we have to call the cardiologist. You have to go in, I've had to admit people into the hospital not because of the cancer treatment or the tumor itself, but because of some heart problems they've had unrelated. They can just arise spontaneously or unexpectedly during the treatment. They might not have anything to do with the treatment. It's just a matter of being sure that the cardiologist is kept informed of what we're doing, so they kind of are tuned in to be ready in case something happens unexpectedly. You're worried about chemotherapy-related heart failure. Fortunately, that's actually something we can prevent, because there's certain medicines, certain chemotherapy medicines, one particular one called adriamycin, which is, patients know it because when you're getting it, it's a bright red medicine in the IV solution. It's the red medicine. So the way to avoid chemotherapy heart failure is to do your best to avoid giving that particular medicine that has a risk of heart failure. If the patient needs something like adriamycin or a relative medicine related to adriamycin, then what you do is you do two things. You monitor the dose, so you have to space it out and give the proper dose and not go beyond the total dose, the toxic dose. So that's one way. And the other is to, if it's a prolonged type of treatment, you need to monitor the heart function every few months. So normally every 3 months we'll send a patient for a heart scan or ultrasound to check to see is there any sign of heart failure whatsoever. And usually if you do that, you can essentially avoid any kind of chemotherapy-induced heart failure altogether. Well, if you've already got any kind of heart disease before you even come in to see us and you've got a diagnosis, you need treatment, normally you're not necessarily going to have to automatically worry about the heart disease getting worse, because most of the chemotherapy or the other treatments we give don't interfere with, don't exacerbate or make heart problems worse that were pre-existing before the diagnosis of cancer. So it's not normally, except for the heart failure with certain chemotherapy medicines that can occur. Apart from that, it normally is not something we see a lot of, that heart problems that were pre-existing will get worse. We don't normally see that. Well, for patients who have pre-existing heart problems and they're followed by a cardiologist, I recommend that they continue to be followed on whatever schedule they have been following before, and to continue the medicines, of course, and continue whatever other recommendations they made and how they eat and how the things to avoid, like smoking. But also, we, in our system where we have our clinic notes where a patient comes in and I evaluate them and do the note in our system in the computer, we automatically always send it to the cardiologist as well. So they're always kept up to date all the way up the line during the treatment about what we're doing. And so if there's a problem, they're going to already know the patient, what we're doing with that patient, what kind of treatment we're doing.